Hi, this is Andy Wolf recording a video for the ISHA library of a talk that I gave at the physiotherapy program at our annual meeting in Washington, D.C. on October 19th, 2024. This is Return to Play for the Hypermobile Athlete with case presentations. So I picked a couple of cases here to help illustrate an important concept that essentially some of the measurements are not all created equally, and hypermobility on patient demand has play a big role in terms of how we need to approach these patients. So the first patient is a 14-year-old female gymnast with 2 years of right hip pain of insidious onset who has failed physical therapy and has been unable to participate in gymnastics. She has groin pain without lateral pain and pain with activities of daily living. She has an MRI arthrogram showing an anterior superior labral tear and a hypertrophic labrum without chondral damage. This is her x-ray. You can see she's slightly dysplastic. And here's the second patient. Patient B is a 22-year-old male Division I hockey goalie with 6 months of right hip pain of insidious onset, pain in his groin only, and he's had a decline in his performance and pain with playing hockey, but no pain with ADLs. Similarly has an MRI showing an anterior superior labral tear and a slightly hypertrophic labrum without chondral damage. And these are his x-rays, which are notable for having very large cam lesions and slightly and somewhat dysplastic acetabuli. In fact, when we look at the x-ray measurements in these two patients, the gymnast and the hockey goalie, their measurements are essentially the same, with their lateral center angle being 18, their anterior center angle being 18, and their tonus angle also being elevated. The main difference, though, is the alpha angle, where they both have, where the goalie has a very large cam lesion that is not present in the gymnast. So, do we have treatment recommendations yet? Well, let's get more information. So, on physical exam, they both have positive anterior impingement tests, but patient A exhibits excessive supine internal rotation with the hip flexed to 90 degrees, whereas patient B has more of an impingement type of exam with 0 degrees of supine internal rotation. Additionally, the patient B, the goalie, has a relatively retroverted femur with 0 degrees of femoral anteversion, while as the gymnast has a normal or slightly increased femoral anteversion. And then the final thing to note is the Baton score of the gymnast is 6, while that of the goalie is 0. So now I think we're getting into treatment recommendations with respect to these two patients, because I think they will act very differently. And my recommendations, these are both patients from about 10 years ago. The first patient, the gymnast, I recommended a combined labral repair and PAO. The hockey goalie, I recommended an arthroscopic procedure only with a cam correction and labral repair. The gymnast sought opinions from osteotomy surgeons and decided against that. Similarly, the hockey goalie was recommended to have a PAO, but also decided against that. I did not recommend that. And so this is the gymnast pictures, and so we did a labral repair. And against medical advice, she did very well, but against medical advice, decided to go back to gymnastics. I had advised her that if she were not going to get a PAO, that she at least needed to chill out with gymnastics. But her symptoms returned, and we counseled her that likely she will need to get a PAO. The hockey goalie did very well. We repaired his labrum and performed a cam osteoplasty and capsular closure. And this is his post-op X-ray. We can see where we corrected his cam type impingement on his right hip. And he was able to return to play at 4.5 months without further problems. And so I think that this illustrates the reason for the outcomes for both of these patients. In the gymnast who had the hypermobility, her problem really was not was really one of dysplasia plus hypermobility, whereas in the hockey goalie it was much more of an impingement problem than a dysplasia problem, and the dysplasia really was not relevant, although they had the same measurements on their acetabular indices. The soft tissue and the femoral version played a big role in terms of understanding why these patients got to the point of having symptomatic labral tears, and that sort of understanding what's driving this helps us formulate a smart treatment plan for these patients.